Asthma. Asthma definition, it is characterized by recurrent attacks of WBC, W is wheeze, B is breathlessness, otherwise called dyspnea, and C is cough. Caused by reversible airway obstruction. Reversible airway obstruction is the most important criteria and is the most characteristic feature. Okay, so wheezing is a characteristic feature of asthma, and asthma can present maybe exclusively as cough as well. I think there are three factors which contribute to the airway narrowing in both small and the large airways. The first one is bronchial muscle contraction, which is triggered by a variety of stimuli: mucosal swelling, mucosal inflammation. Mucosal inflammation is caused by mast cell basophil degranulation, resulting in the release of inflammatory mediators, increased mucus production. So three M's: muscle contraction, mucosal swelling, mucosal inflammation. Recent advances: exhaled nitric oxide. So exhaled nitric oxide is now being used as a non-invasive test to measure eosinophilic airway inflammation. The typically elevated levels in asthma are reduced by inhaled corticosteroids, so this may be a test to compliance with therapy. And yes, plus also, yeah, or maybe after giving corticosteroid trial, if the nitric oxide is going to be reduced, it means the response to therapy will be good as well. Right, so there is a extrinsic and intrinsic asthma, and there are nine differences between intrinsic and extrinsic asthma. Okay, so history of atopy is present in extrinsic asthma. In intrinsic asthma, it is absent. Okay, so there are totally 9 points. We'll remember A. A is atopy. No, A is age of onset. A is atopy. A is associated feature. A is aspirin. Okay, and then E. E the environmental exposure. E is IgE. Okay, so 6 are over. Still only 3 more. 3 the first is sensitivity. No. First is severity, then response to bronchodilator, and then total patient percentage of total patient. Okay, so yeah, remember RST and AERST. AERST, AERST, or a rest. Okay, A stands for age, atopy, associated feature, and aspirin. Age in case of extrinsic asthma, it's going to be young and early. Intrinsic asthma is adult and late onset. Another A is atopy. Atopy is present in extrinsic asthma, it is absent in intrinsic. Associated feature, no associated feature in case of extrinsic. For intrinsic, there is associated with nasal polyp. It's called Samter's triad. Samter's triad has rhinosinusitis, aspirin intolerance, and asthma. Okay, and finally, aspirin, final A, sensitivity to aspirin, no sensitivity in case of extrinsic. Intrinsic, it is sensitive. Okay, E the environmental exposure is present in case of extrinsic asthma, absent in intrinsic. IgE level is elevated in extrinsic asthma. E is elevated in extrinsic, triple E. Okay, and normal in case of intrinsic asthma. Just remember, intrinsic asthma is because of stress and all. Severity: extrinsic asthma is less severe and intermittent. Intrinsic is more severe and persistent. Just remember intrinsic, so like whatever is inside the head is going to be more severe, more persistent, cause of depression. And severity, R is response. Response to bronchodilator is better with extrinsic asthma and worse with intrinsic asthma. Total number of patients, 80 to 90% is going to be extrinsic asthma, only 10% will be intrinsic. So that is the nine difference between extrinsic and intrinsic asthma. Extrinsic asthma is also called allergic asthma or atopic asthma or intermittent asthma. Intrinsic asthma is idiosyncratic asthma. So there is no obvious cause. There are certain causes of acute exacerbation. Yeah, so there is a story. Just watch that video. And then important points are asthma reversible airflow obstruction involves both large and small airways. Intermittent asthma responds better to bronchodilator. Asthma is diagnosed by demonstration of reversible obstruction. With that, we will end. Thank you.